Welcome everyone back to another episode of the Parkinson's Policy Podcast, where we advocate together to raise awareness and advance meaningful policy for the Parkinson's community. From Washington, D.C., at the Capitol and beyond, we bring together senators, representatives, researchers, and advocates to amplify the voices of people living with Parkinson's disease and their families. My name is Dr. George Ackerman, Sharon's son and founder of TogetherForSharon.com, joined by my co-host, Margaret Preston, the president of Power Over Parkinson's, and we want to welcome everyone back to another episode.
Yeah, thank you so much, George. I have the pleasure and honor of introducing our two guests today who really don't need any introduction at all. I'd like to start with Dr. Michael Okun. He's a board-certified neurologist, movement disorder specialist, neuroscientist, and author who practices with the philosophy that the patient is the sun and should be at the center of all care decisions. I want to move on to Dr. Ray Dorsey. He's the director of the Center for Brain and Environment at the Atria Health and Research Institute. The center's mission is to identify the root causes of brain disease from autism to Alzheimer's so that we can prevent them. With his colleagues, he wrote Ending Parkinson's Disease and the Parkinson's Plan, which details a new path to preventing and treating this terrible disease. I want to welcome you both to this show, and thank you so much for sharing your time with us today.
I've been with both of you.
Well, we know you well, and I've had the honor to meet one of you and hopefully the next one also very soon at World Parkinson Congress. But maybe we could start the show by each of you telling us, what got you into this type of area of work, and one other area is, why is, because you've both been doing this for so long, why is policy out of, in a way, nowhere becoming, I feel, the most media prevalent and important topic in the world for Parkinson's awareness?
Yeah, I'll start and just say, first of all, thank you both. George, you're a voice that is, continuous and you do such a great job of amplifying everyone and bringing together, the community. And Margaret, everything you're doing for both now moving along to policy, is so important. And then merging up, everything you're doing in Virginia and amplifying that around the world, super important. I'll just say that, it really comes down to one sentence, and that's that prevention isn't a pill, prevention is policy, okay? And so when we think about that, we have to, move beyond what we've been doing. Dr. Dorsey and I are in our third decades each, so that puts us together as pretty old men. And when we think about, how long we've been at it, we haven't spent a proportionate enough of our time talking about the things we need to be doing, both in care, research, and education, to shift to the discussion so we can have true policy changes so that we can actually reduce the numbers of folks who have Parkinson, develop better treatments, amplify into, better care models. And so it's not enough for us to just be publishing hundreds and hundreds of papers and occasional books. We need to be talking policy. So we're super happy. Ray, what are your thoughts?
Yeah, so first of all, thank you very much, Margaret. Thank you very much, George. Amazing that people like you leading the way. I was at an event, an art event in New York City, and I was speaking, I think, to a husband of someone with Parkinson's disease who had previously worked on cystic fibrosis. And he goes, Ray, the challenge with cystic fibrosis was scientific. We knew what the cause was. It was a genetic mutation in a gene, and that we needed to figure out treatments to help people who have this inherited disease. So the challenge with Parkinson's disease is political. The challenge with Parkinson's disease is political. Only 13% of Americans with Parkinson's disease carry any known genetic cause or genetic risk factor. For the vast majority of people with Parkinson's disease, that they're suffering with this terrible disease. Margaret's father, George's mother, because of exposure to chemicals in our food, water, and air. If we get these chemicals out of our food, water, and air, if we ban paraquat, if we ban trichloroethylene, if we ban perchloroethylene, if we stop spraying 2,4-D and component of Agent Orange on golf courses, if we get rid of chlorpyrifos, which is costs 26 million American children 17 million IQ points, we say goodbye to Parkinson's disease. For the vast majority of human history, Parkinson's disease was extraordinarily rare. Only in the last 2 centuries have people been varying in increasing numbers. If we summon the political will, we create a world without Parkinson's disease, just like we create a world without polio, like we create a world where lead poisoning is much, much less common. than it once was. We can do the same thing for Parkinson's.
Thanks.
I wanted to jump into that, kind of going right into advocacy and specifically kind of the latest news on the National Council. Now that we have those folks seated, talk to us about what you guys think are the priorities as they kind of familiarize themselves with what's going on, what's needed. What do you guys see as the priorities in this first chapter of the council?
Also, congratulations to Dr. Okun for being named to the council.
Yep.
Yeah. Well, first of all, it's an honor to serve. Really, the council members, as congressionally mandated, have to be drawn from a broad scope, including persons with disease, including young onset, including some of the other Parkinsonian syndromes, including psychiatry, gerontology, and so I think the representation has to be broad. But the real, core of this is it's a chance for us to create an inflection point for Parkinson. So an inflection point is where we're traveling along in the same sort of direction. You're kind of functioning along on that family, car trip, and you know exactly where you're going and everything. We actually want to change direction here, and we want to provide changes that are gonna, in some concrete way, move the field forward. And so, I believe that the first and most important step is listening to everyone, so making sure we're getting input from everyone. Everybody's voice counts. Even if you don't want to hear the voice, like even if you're like, oh, I'm tired of that voice, or, oh, this is, we have to listen. We have to actually stop and listen to everyone. So I think that's the first thing. But I think the core of the challenge for this type of council is getting something done. Okay, so tangibly moving the concerns of the field into a framework that then can be translated into action, so we can truly, look at Parkinson's disease differently. We need to look at our failures. Okay, and I think if we look very in a very honest way at where we failed, and then we look at where others have succeeded. Ray and I write a lot about polio, HIV, and cancer. Look at those successes. Then you know that there is a path to us restructuring our care system, restructuring, how we're doing research, spending 2 to 4 pennies on every dollar for prevention, both here in the United States and around the world. It's not going to do it. We're not going to move the needle with those types of things. And what sorts of strokes of the pen could shift us into the right direction, into the right paradigms? Can we think of ourselves more like, how cancer and HIV have set up their programs? Can we learn from what's going on in the Alzheimer's field? So I think the biggest challenge is you've got an overwhelming number of things that you start with. You want to get everybody's input. But at the end of the day, we need to create the POW, and the change on a few things, one at a time. And so I think that's the challenge. The committee begins its quarter. It's going to be quarterly now for several years. It begins here in June. There's going to be lots of open access for people to give their comments. And I think we need to sit back and not talk at people. I think we need to talk with people. We need to listen. And then that group, plus the group of federal officials, so there's voluntary officials from outside the federal government like me, is going to have to translate this into action. If we don't get something done, if we just create a paper that doesn't get anything done, that's inadequate. And so we really need to use this opportunity to create change.
I want to thank both of you for using your platform and your education and your work experience to not just, stay in the medical field, but also to kind of branch out also into environment, into the work you're doing in policy. Because I always am shocked at how others aren't doing that. And at least in my small view of the medical field, I have every other degree except for an MD. And you go to your doctor, you see your doctor, you leave, and then that's it. But you two are not just doing work that's just in the U.S., it's really worldwide. So I want to just take a moment on behalf of myself, Margaret, and the community to really thank you for bringing attention to policy, because like you said, really feel this is the way as an attorney. I mean, that's the only way we can really get things done. Now it's up to all of us out there in the council to make it happen. So for Dr. Okun, just continuing based on current research, because both of you have been researching for many years and decades, three, you said, what gives you the most hope for slowing or preventing Parkinson's disease in the near future? I know obviously environment's a big one. I think that's personally why and how unfortunately we lost my mother due to Parkinson's.
So for me, it comes down to understanding that we can't get so comfortable about believing we know where Parkinson starts, where Parkinson progresses, and how it spreads. And so I would caution people from getting, too much into the comfort zone of thinking they have the answers, because we don't. Okay. And, we know a lot. We know a bunch of genes. We know a bunch of the pathways. We see when the garbage can, tries to throw away the synuclein. So we've got a bunch of the picture, but we don't have all the puzzle pieces. And when Ray and I wrote, the Parkinson plan, we interviewed a lot of people from all over the world. And one of the people that we interviewed was a guy by the name of Ed Boyden, absolutely brilliant scientist. He's at the Massachusetts Institute of Technology at MIT. And it's people like Ed that are building the tools that are going to be necessary for us to take the next steps. And it's not, the blame isn't completely on us, for not getting the full picture. We are not, we're only investing a couple of hundred, million, 250 million or so in NIH dollars to move the field. We're going to need to be investing like 2 or 3 billion a year, and so we're not putting enough in. And then as we look at things, synuclein's like what's at the end of the stream, so if you look at a stream in nature and you see all these dead animals at the end of the stream and you say, oh my gosh, Margaret, like what happened to all these animals? This is terrible. George, what happened? Oh, they hit their heads on the rocks, right? No, we have to walk up that stream and see what happened and why these animals are dying at the end of the stream. So we're sort of at the end of the stream in Parkinson. And one of the things that we've been hampered with is the tools to look up the stream. And so Ed Boyden makes that point when we interviewed him, and I think it's a really important point. The tools haven't been developed yet, and we need to work together to develop the right tools to go up that stream. Why does it start? Why does it spread? Why does it progress? As we do that, I'll get more excited about the types of therapies that are going to emerge, because we're still kind of in a bit of a needle in the haystack, paradigm. We have the miracle drug of levodopa, and it is a miracle. It's over 50 years old, as Ray always says. And we got to move, beyond that. So Ray, what are your thoughts?
I think we have with a lot of tangible things that we can do. One, we can ban paraquat. 70 countries, including China, have done so. Second, we can ban trichloroethylene and perchloroethylene. We're paying a really high price so our clothes don't shrink. These decreasing and dry cleaning chemicals are associated with about a 500% increased risk of Parkinson's disease, and one's known to cause cancer and one likely does. We can ban chlorpyrifos. The EPA has already done this in 2021, but the manufacturer successfully sued to overturn that ban. We can get rid of 2,4-D, a component of Agent Orange that's sprayed on golf courses throughout the United States. We can stop subsidizing the use of pesticides. The two crops that are subsidized in the most United States with our taxpayer dollars are corn and soybeans. The two crops that are sprayed with the most paraquat in the United States are corn and soybeans. We can start to measure the number of people actually with Parkinson's disease. We don't actually have a good number of how many people are diagnosed with Parkinson's disease in 2025. If we don't bother to measure something, how are we going to manage the disease? So I think there are lots of tangible things that we can do right now to prevent, slow, treat, and create a world without Parkinson's disease.
Yes. Thank you. I think so much, George and I have said this before, but so much is predicated on data. And you guys, I know, write about that as well. We've got to understand kind of what we're working with and the numbers in front of us, I think, to then take action and be a little bit more proactive than reactive. And I do want to note, we do have a miracle drug, carbidopa, levodopa, but it's time-stamped, right? It loses efficacy. It comes with other side effects in the long term. Personally, we see that now with my father, and we could do better. But it all starts with data and ultimately funding. Like you said, we need to get to that 2 billion versus a couple hundred million. It's not doing it. Dr. Dorsey, I wanted to jump into offline. We were talking about centers of excellence, how lucky we are to have something in our backyard as a center of excellence, a Parkinson's Foundation Center of Excellence. Not everyone has access to care. Not everyone has access to a movement disorder specialist. What policy related changes, what needs to kind of move the needle to allow folks who are underserved in more rural neighborhoods to be able to have better access to care? What do you think that looks like?
Michael's the expert here. I'll start. I think Michael and I called for a 10-fold increase the number of centers of excellence throughout the country so that more and more people can get access to care. People in the Parkinson's community are upset. They know that there are really great places to get care. Michael was heard from a person who said, I'd love to come to the University of Florida, but the wait time is a year. And that really shouldn't be acceptable. So we need to increase the number of centers of excellence. But we need to be mindful there is no way we're going to ever train enough doctors, create enough centers to match the rise in Parkinson's disease. If we don't take action to prevent people from getting this disease, it's only going to be a futile exercise. I've got to tell you about the story, the parable of the river. Story of these children, injured children are found in this river, in this community, takes this baby out of the river and cares for it. And the next day, 2 more children come down and they take the child out of it and they care for him. And the next day, 3 and so forth. And initially they weren't very good at caring for him, but they got progressively better and better at caring for these children. And more people in this community were devoting their time, energy, and resources to caring for these sick children. They were doing such a good job that the local priest came by and blessed them for their good work. They were doing this and it's coming out of sacrifice from doing their usual activities. And then one day, one of the workers, he leaves the care center and people go, where are you going? And he goes, I'm going upstream to find out who's putting these babies in the river. And we're not finding who's creating Parkinson's disease. We're not finding out why your father has Parkinson's disease. We're not finding out why Sharon developed Parkinson's disease. If we find out why people are getting these diseases, we get to create a world without them. Just like we create a world without polio, there's no polio treatment centers. March of Dimes doesn't even fund polio work. There are no polio specialists, no polio treatments, no polio, much of anything. Just a world without polio. And I think we could get exactly the same thing for Parkinson's.
Yeah, and I'll just add, when you think about, care, and you think about models, and you think about the growth, and the idea that as we looked at the global burden of disease study in 2020, when we wrote Ending Parkinson's Disease, everybody was like alarmed, that the growth was, so high. And they were thinking, well, maybe there is a pandemic. And then when we wrote the Parkinson plan, we had already reached the growth that the global burden of disease study predicted we would reach in 2035, and it was 2025. That's right. Oh my gosh. So you got this increasing number of people that need care, and the system isn't working right for the people. Okay. And so we have chess pieces on the board, but we're going to have to move them in a different way. And so when we think about centers of excellence, and designation, one that has to mean something. So like with the Parkinson Foundation centers, they go out and they certify these centers, and they go back and they look and they see and they make sure that they have the things that they need to have. The American Parkinson Disease Association centers have a similar, process for their centers and research centers and things. And so that there is sort of some standards, and people don't always like standards, but I think we need to start to think about what those standards are. And we have to think about how we're going to funnel. And this is a problem, George and Margaret, that's been scaled before, like how you scale when you have limited resources, how you get people the care that they need. And so when we looked at the geography, Ray and I were sitting together when we were writing the book. We had this conversation about the geography of the United States, how many centers of excellence we have, how geographically dispersed they are, and how many people, per region should have access. And then, we need to be deliberate, in putting, these, care centers. And so there are centers of excellence. There are also care centers. And we need to be deliberate where we put these things and put funding into that so we can create that funnel. Okay. And so, people like me and people like Ray Dorsey that have been around a long time, our wait lists are over a year long. We work to get people in and everything. And, that's, I guess some people would say that's to be expected. Some of my partners here at Fixel who are younger, their wait lists are much less, but we're overwhelmed. Like, even if we open the doors to everyone, we're only training 40 experts every year, where the Medicare dollars have been spent on cardiologists and nephrologists and endocrinologists, and rheumatologists. And, we just historically came too late to get the money. Perhaps those are things that we could change policy so that we can make sure that we're providing the right number of people that are in training so that we can get the care to folks, and also expanding our training to geriatricians and to general practitioners and to psychiatrists and PM&R folks. And the more, the better. So we have a challenge, and this is a challenge, and this is a podcast about public policy. It seems to me that there are several things that we could develop a better policy that would create that funnel so people wouldn't have to wait to see Michael Okun and Ray Dorsey or to see one of our partners, and then we could figure this out.
We've been touching a lot on environment. It's an international issue. I remember just the other day, Australia is really pushing to ban paraquat. I have them on my show too. Australia and US are the ones we're waiting, for on this. But with environmental factors affecting likely Parkinson's disease, what immediate actions can individuals listening really make on policymakers to take reduced risk? Because we need everyone in this. I know when I drive even down South Florida, every block's another horrible, no offense, I'm a lawyer, so we'll protect ourselves. We won't say the name, but I see like 20 different fast food restaurants, and I'm not saying they can cause it, and a golf course on every block. So I'm just, it's not that easy, I think, to move the mountains, but what can regular people out there, and even not just in the community, but in all of the community, not just people with Parkinson's or caregivers, but also outside, help join together and really as a team to reduce risks and take a stand themselves. Again, going to the policy forum with Dr. Dorsey and also so many others is just a great feeling. But I always say the work starts literally when we get home.
So lots of things. So Michael and I put together a Parkinson's prevention pyramid in chapter 10 of our book, The Parkinson's Plan. It's available on Amazon. So what can you do as individuals? 25 actions you can take in your everyday life to reduce your exposure to these chemicals. Increasing evidence suggests for people who already have Parkinson's, that cessation, reduction, and exposure to pesticides, dry cleaning chemicals, air pollution can possibly slow the rate of progression of the disease. So we tell you what are things you can do: buy organic, washing your fruits and vegetables, using a water filter, checking your well for pesticides and industrial chemicals, using air purifier. 25 actions you can take in your everyday life. Many of them are free. Some might even save you money. A few will cost you a little bit to reduce your risk of getting Parkinson's and slow your progression, likely if you already have it. Second, what can you do in your community? In the process of writing the book, Michael and I discovered that pesticides are routinely sprayed on kids' schools and playgrounds. Can we contact our school and ask them to stop spraying pesticides on our kids' schools and playgrounds? That's in the control of just about all your listeners. Kids don't mind weeds. Kids play with weeds. We can stop doing this. Kim Copty, Lisa non-toxic neighborhood, she's got rid of pesticides on baseball fields in Irvine, California, and it's trying to do the same for the rest of the country. If you like golf, fantastic. It's a sport that's outside, it's physically active, and it's social. What more can you ask for? What you can ask for is to play golf or to live near a golf course with not being exposed to toxic pesticides. Can you contact your golf course and say what pesticides are you using? Can we not use 2,4-D? Can we not use chlorpyrifos? Can we use less toxic ones? Can we spray less frequently? Can you do me the courtesy of letting me know when you spray so I can close my windows, turn on my air purifier, and maybe go out of town for that weekend? Third, our actions. What can we do as a society? People with Parkinson's disease and their spouses are 1% of the U.S. electorate. People with Parkinson's and their spouses are 1% of the electorate. If you add in their children, you get to 2 to 4% of the electorate. If people make their voices heard, politicians will respond. We saw this last week with politics, people versus poison. People really getting upset that the makers of glyphosate want to have legal immunity to spray their pesticide, which has been linked to cancer, without any recourse for the public to take action and to recover the harms that they've suffered. Chemicals in our environment have robbed people of their lives, of their livelihood, of their independence, of their mobility, of their ability to enjoy life, and have given them a terrible disease. We need to stop subsidizing these chemicals. We need to ban the chemicals that are the most offending agents, and we need to create a world without these chemicals so we can prevent people from ever getting Parkinson's in the first.
Thanks. Yeah, I hope everyone who might be in the Parkinson's community can share this with people who aren't. They really feel that. I mean, I know when the national plan was just being discussed or passed, I actually targeted over 200-300 podcasts around the world that had nothing to do with Parkinson's, because we need those people too involved. And that's just the one thing kind of struggle with too, because these tips are incredible. I mean, I didn't even think of, even though I have 3 children, the kids' schools, so now I'm going to go right to someone about it. But I wonder if those who aren't aware, how do we get them more involved? Because we need, again, everyone. So thank you.
Politicians respond. Politicians respond. If people make their voices heard, they will respond. You saw that in DC. You're going to see a lot of this over the next 6 months. If people in the Parkinson's community want to create a world without Parkinson's disease, they can do so by telling their politicians, red, Republican, and liberal and Democratic ones. We can shout out to Congressman Gus Bilirakis and Jennifer Wexton, Senators Sonny Moore Capito, and Chris Murphy. These are people across the political spectrum who all want to create a world without Parkinson's disease. This is something we can achieve in our generation. As a neurologist, I can't think of a better gift to future generations than a world without neurological disorders.
I wanted to kind of expand on the environmental factors and not to play a blame game, but I wanted to talk about the federal inaction that we've seen. Lately we've been seeing a lot of state action. We actually had a bill here in Virginia that was tabled till 27, but was a bill to ban paraquat. We are hoping to kind of continue to talk to lawmakers during the summer, during the off session, and hopefully make some headway in 27 in the session. But I want to talk at the federal level. There's lots of great action at the state level. What barriers have really been in place, unfortunately, at an agency level that really has gotten in the way in terms of bureaucracy, red tape, politics, like you had mentioned, Dr. Dorsey? What is there? What can we put our finger on in terms of inaction from the EPA, et cetera, for banning these toxins in our environment?
So first, I forgot to shout out to Congressman Paul Tom Goat, who's one of the chief sponsors of the national plan. Yeah. Why don't you invite someone from the EPA and ask them?
Us, we actually, I've written to every single one in Florida and every federal, and we haven't even had a reply, and I won't stop, me, but that is there's not a person, even Kennedy, that I haven't invited, and I'll keep trying. But if you two, know anyone, there's an open call to all.
The record show, that.
But it's clear these individuals work for you.
Yeah, but
if they're not responding to you, why is that?
I think it might be also lack of awareness, or they just don't care. Unfortunately, in my opinion, we are getting incredible state response, but I've written to every single, at least 30, and I'm going to write to every single U.S. Senator. The only one who has responded is U.S. Senator Rick Scott.
Yeah, I agree with Ray. I do have to say that, that we need to be open and realize a lot of people have a lot of opinions, on these, challenges. And so it's really not enough for us to just say we're right, that really is not going to get us where we want to go. But if we could just create dialogue with people, communities, and that's why I always say, the idea of tell your story, 3 words, is so powerful. When the people and the constituents begin to tell their stories, that gets the attention of others, and sharing those stories, so when you're trying to engage, politicians, administrators, people that are, in federal positions that might be able to take on some of these policy challenges for you, my advice would be to share the stories, send them the video, of the stories. I'm a constituent, even a short video. It says I'm a constituent, the state of Florida or the state of Virginia, And here's my story. And this is why I think this matters. This past week, WUFT at the University of Florida, there's a series of 8 University of Florida students that have written tremendous articles on a series called Poison Pathways, where they examine these things, and they go and they're talking to people, and there's real people and real stories and real discussion, and they don't say 100% cause this or that. They're telling the stories of people, they're telling the exposures, they're telling the concerns of the public, they're talking about the science and where it is. And and I think that's a beautiful thing. I think that's how the system should work. And so I think cracking through George, you're the best at this, but cracking through the armor, because you will continue to pursue and to persevere to get through the armor. But I do think that it's the stories of the people that matter the most, and the people of this generation, but also them talking about, I'm concerned about my kids and their kids, And Margaret, in your case, you talk about your father courageously and openly. George, in your case, you talk about your mother, courageously and openly. Those stories matter. It matter to you, and they matter to over 1 million Americans. And so that's kind of where I would say dialogue, tell your story, don't quit, persevere. But the more you can put the stories in front of them, then it doesn't become an echo chamber. It's like, well, you know what? Listen to this. Just listen. I mean, and just keep an open mind and listen. We don't have to change your mind. Just listen. That's it. That's all we're asking.
So just building off that, so in addition to sharing your story, you need to make sure your voice is heard. Your voice must be heard. You should not let Parkinson's disease rob yourself of your voice. The most effective spokespeople for the Parkinson's community are not neurologists. They're Margaret Preston, they're George Ackerman, they're people who've been directly affected by the condition. So make your voice heard. And if it's not heard, turn up the volume. And if that doesn't work, try a different approach. But you need to share your story, as Michael indicated, because the people who will change the course of the disease are those who are most directly affected. But you need to make sure your voice is heard. And if it's not heard, turn up the volume.
I couldn't agree with you guys more. We had a state advocacy day a little over a year ago here at our Capitol, and we brought a bunch of patients, care partners, et cetera, and just had them share their story. And the amount of lawmakers who just needed to hear about the disease was astounding, right? Like, we all live it, breathe it. We all know about the complexities and sometimes take them for granted because we're in this space. But I think we need to remember these lawmakers sometimes think it's a tremor, or, it kind of starts and ends with a tremor, or, it's a movement disorder you can live well with for a long time, which you can. But I think baseline education needs to take place, and we can do that through sharing our stories with our lawmakers, how it's affected our life, the symptoms associated with the disease, kind of the trajectory people have experienced. So I can't echo what you guys are saying more, because it was so important what we did a year ago, what we recently did with the bill that we had, in terms of bringing advocates and sharing their story. Because I think, again, that baseline level of education about the disease needs to take place, I think, before lawmakers say, okay, I get it. It's not just a federal line item in the budget. It's not here in Virginia, it's $1 billion business. It's costing here in our Commonwealth. So, while there are these metrics, I think the stories are going to go farther. The people behind them, they're always going to remember that constituent who came to their office and told their story. So thank you for echoing that as well.
I just want to take a moment now to thank both of you, and of course my co-hosts, but you two have always been there, I know, for me and for Margaret from the beginning. If we asked you to help us or just advocate together, there's not even a moment you haven't support us. And that's something behind the scenes and people might not know, but it's something that I'll never forget. And on the tough days when unfortunately I can't, hug my mother or say, call her, and days where I feel like maybe it's time for me to wrap up and stop or just close the chapter because I can't do much more, I see you both, and I get to meet you and I get to share these stories and advocate, and pushes me to realize none of us can give up until others don't have to battle this anymore in my mother's memory, but also all your patients and friends and family that you've now, really helped over the last 3 decades. So I just wanted to thank you both. As we wrap up today, I wanted to know if you could, each of you leave a message of encouragement, which really you already have, but for the Parkinson's community, what would that be?
Ray, why don't you start?
Okay. Well, don't stop. The fall of Parkinson's disease has already begun in Western Europe, where they banned paraquat, where they banned trichloroethylene, where they clean up their air. The incidence of Parkinson's disease in England is stable or falling. The number of new cases of Parkinson's disease adjusted for age in the Netherlands is either stable or falling, and Germany is just falling. If Germany can do this, if Netherlands can do this, if the British can do this, then Americans can do the same thing. The only question is when. The sooner we act, the sooner we don't have 250 people being diagnosed with Parkinson's disease today in the U.S., the sooner we don't have 100 Americans dying of Parkinson's disease today in the U.S. People like George and Margaret and many, many, many others across the country and around the world, if they make their voices heard, we create a world where Parkinson's disease is increasingly rare instead of increasingly common.
Thank you.
Yeah. My message is simple. Tell your story. Let's start with the people. Let's let the people speak, and let's amplify their voices, and let's get something done.
Thank you. I'm going to send the show back to wrap up to Margaret.
Yeah, I just want to thank you guys so much. I know you guys are busy doing very important work. So I appreciate you guys sharing your time with us. As someone obviously with a parent with Parkinson's and fully understanding the insidious disease that it is, I am personally so grateful for your work. You don't need to be doing this. It could be all clinical. But you've decided to take this stage and really fight for all of us who are battling and watching our loved ones battle this disease. So thank you for your work and for sharing your time with us on this show.
Thank you. Thank you for your work, both of you.
Thanks. I want to thank you all again. Also, everyone listening, also my co-host Margaret and Adam and the whole staff behind the scenes at POP. I also want to thank this community. Without you all, many of us wouldn't make it through the day, and that's why we keep doing this. I want to thank, of course, the doctors. I had the honor to meet Dr. Dorsey many times, and even though I'm 6'2", I look like I need to, not shrink anymore. And can't wait out of bias to meet you, Dr. Okun, just in this month in a few weeks. I'm excited to still advocate until we find important conclusion to these topics. So thanks, everyone. We'll be back for another episode soon. But this has been another episode of the Parkinson's Policy Podcast, where we advocate together to raise awareness and advance meaningful policy for the Parkinson's community. We love you all, and we'll see you soon. Thanks, everyone.
Thank you.